Okay, that sounds terrible. Let's go back to perimenopause and you can walk us through
say
it.
that again. It sounds terrible to you. Why?
Well, because these things are like estrogen for a woman and well, all hormones, it's what keeps us alive and going and healthy and mentally well. And it sounds terrible. It's like pulling the plug on life.
For some of us, Doug, it's horrendous.
Welcome to The Epicist. I'm Doug. Today we have one of my favorite, I'm not even going to call you a guest, I'm going to call you cohort, Kelly Knoll, the nurse practitioner. We've done many episodes in the past, and we did the one back a while back on narcissism and narcissistic personality disorder, which was really good. You interviewed me, and I think... I just love doing podcasts with you because it's always fun. And I think that we're going to kind of interview each other in this one, right? I think we'll do it just a little bit differently. We'll see how it goes. So why don't you tell us about what's going on now in your life? And because you're doing really well.
Oh, okay. Well, thanks. Thanks for having me back. I'm back. Everybody, nice. Wake up.
Yay.
Yeah. What have I been doing? Well, I started Kelly's clinic. It's a virtual health clinic, as you know. It's a private virtual health clinic.
And I think it's been through a few iterations of Kelly's clinic. I think you found your groove.
Oh, it's been through quite a few reiterations. What do we say that?
Whatever.
As a businessman, watching must
versions.
Be
There's been different versions of Kelly's clinic.
But my heart is still like I still have my heart today.
Yeah.
That wanted to start a clinic to give people personalized, care.
Yeah.
Like that I couldn't give in the public health system in 10 minutes. And more particularly this, perimenopause and menopause.
So you went from just a general, because you're a nurse practitioner, you wanted to set up a clinic, you wanted to help women and men, I think, but mostly women, I think. Am I right?
Well, you know what, Doug? I just wanted to help people.
Okay, you wanted to help people.
Yeah.
I know you well enough to know that that's legit. Like, that's not just a thought. That's part of who you are. And so you started Kelly's clinic, but you tried different versions of Kelly's clinic, and you finally reached, I think, one that really is good for you.
Yeah. Well, okay, first of all, what you don't know. What you don't know.
There's a lot of things I don't know.
Yeah, remember I got a game 10-10. No, but what you don't know about me, Doug, is during the pandemic, like I was working, in the beginning, I was right on the front lines doing the testing and the vaccination right in there,
Yeah.
And then I got introduced to virtual healthcare because everything was shut down, right? And so virtual care overnight blossomed.
Yeah.
I had some familiarity with virtual care because I had been doing, of course, some cannabis suitability much prior to when it became legal for medical purposes. So I had some experience with virtual care, and I really liked that people who had no access across Canada had access, right? So during the pandemic, I worked on every single virtual care platform that exists out there. So nice. I know, and so what started coming in was like very common symptoms, like common conditions, and it was women in menopause and perimenopause who one just didn't know very much about their bodies and what was going on, and I had quite a bit of experience with myself and in my practice. So that's really where I got the idea for, wow, women in Canada, they need access to healthcare professionals, doctors or nurse practitioners who can prescribe hormone replacement therapy.
Oh, amazing. So just a bit about but a bit about nurse practitioners, because, as you know, when I met you, that was a very new thing. I'd never even heard of a nurse practitioner. Obviously, I'd heard of a nurse and a doctor, but I'd never heard of a nurse practitioner. And basically, my opinion is, in some ways, you're better than doctors because you're more open to, doing things that maybe doctors wouldn't be willing to do. But you can prescribe medication, and you can prescribe things that a naturopath can't prescribe and
Well, naturopaths, they have very limited
very limited.
prescribing rights.
But you have almost the same ability as a doctor, right? To some degree. And so I was really fascinated by that. And so now, nurse practitioners on the top of my radar of what, this is important. And we talk about getting the word out, like nurse practitioners in most other countries are the go-to. In Canada, we're so archaic in Canada. It's like your guys are almost like sidelined.
Yeah, you're right. But once you know us, aren't we a gift? Eh?
Once we know you, we're not letting you go.
Aren't we a gift?
And especially in this in Canada, where it's really hard to find a doctor.
Yeah.
Like it's really hard to find a GP.
Oh,
Like
no, there's a significant shortage, and it's only going to get worse.
And so the government should be pushing towards nurse practitioners because I think you guys are more available, and there's more of you, I think, or at least more available. I'm thinking.
Well, first of all, we're not that new, but we've been
No.
around since the 70s.
Yeah.
Historically, nurse practitioners were trained to go in remote areas in Canada where no physician wanted to go. And
Right.
that historically. So the scope of practice was to be very similar to, a full practicing family doctor. So,
Yeah.
Our education does include like medical school for nursing, right? It's medical. And so we learn how to diagnose, treat, and prescribe. Unlike when we were nurses, that's not part of our training. So yes, we have a lot of responsibility now. We can prescribe all medication and order most diagnostic imaging. We were very limited when I started like 15 years ago. I'm not quite sure, but there were some limits to what we could order and prescribe and conditions that we could manage. And then, overnight that sort of changed. And
Why did it change?
well, because obviously,
Out of need?
yeah, I think that there's more, you know what? My personal opinion is because there's more controversial conditions that arose that physicians didn't particularly want to own, such as, medical assistance, in dying, that one?
Nope.
Maid. Okay. So, and a lot of the transgender medicine that required hormone replacement, like hormone therapy, a lot of mental health and addiction just starting to become more and more. So just overnight, we were given an opportunity to sort of meet some
I
of
think
these
that's
needs.
fantastic.
Yeah.
So let's talk about. So you got into basically you dealing with menopause. I dealt with andropause, which is the male version of menopause.
Yeah.
We don't go through fluctuations typically. We just go through a decline, which has a different effect, but similar in the sense that it affects so many parts of our existence. So in my decline in testosterone, there was brain fog, there was depression, there was lack of energy, there was so many body just everything was kind of getting worse, and I didn't know why, and it was because of low testosterone. So I do testosterone replacement therapy now, which to me is life altering. But for women, menopause and perimenopause is my understanding, and I'm just going to say it from my perspective because I've watched it in some women, is that there's like these crazy fluctuations, and whether it be hot flashes or night sweats or and so why don't you talk about that, because it seems way more extreme than andropause. Andropause is more of a decline, whereas perimenopause seems like just getting on a roller coaster and hanging on.
Oh, it can be very much like that for many women. So, perimenopause is the period before actual menopause. What menopause is when a woman no longer has a period, a menstrual, like,
Right.
whatever you want to call it, the time of month, vaginal bleeding for 12 consecutive months.
So the menopause is sort of the final stage of perimenopause.
Yeah.
And
But
then
perimenopause,
it just stays that way afterwards.
exactly.
So the menopause is the perimenopause is the preparation for menopause.
So menopause is when your ovaries are no longer producing estrogen,
Right.
progesterone, and testosterone at all, and your body is not making any more hormones at all. Unlike men, who you gradually decline.
Okay, let me just ask about that.
Yeah.
So if the body's not producing, because these hormones are essential, right?
Yes,
For life,
they are,
for
Doug.
health.
Yes.
Okay, that sounds terrible. Let's go back to
No,
perimenopause, and you can walk us through
say
it.
that again. It sounds terrible to you. Why?
Well, because these things are like estrogen for a woman, and well, all hormones. It's what keeps us alive and going, and healthy, and mentally well. And it sounds terrible. It's like pulling the plug on life.
For some of us, Doug, it's horrendous.
Yeah.
And perimenopause, interestingly enough, can start in your 30s. And this is a time where you start getting fluctuations. So your menstrual cycle starts changing. It either gets closer together or longer, further apart.
It could be 6 weeks or 8 weeks. It could be 2 and 2 weeks, and every 2 weeks, and it depends on the month. And it can be severe, or it could be very mild, periods. And
well, and if you're a woman who has had a history of premenstrual syndrome or premenstrual mood dysphoria, moods that change around your period, like there's some people who are really significantly affected by that. In perimenopause, this gets significantly worse. And so, a lot of times our neurotransmitters, serotonin, dopamine, norepinephrine, they all get transmitted with our hormones, right? So if we're low on a certain hormone like estrogen, then so are all our neurotransmitters that help us with our mood. Does that make sense?
Yeah.
So it's a very, significant, dangerous time for any woman who's had a, history of anxiety, depression, postpartum depression, or PMS or PMDD. So,
Oh my gosh.
and Doug, what we used to do for women was just give them, offer them SSRIs, right? Like,
Well, I think there was SSRIs, and there was a hormone, a steroid that they used to give women that caused cancer.
no, steroid.
Yeah, it was.
Are you talking about when we used, so birth control is all is that what you're talking about? Birth
Well, I
control?
don't know, what is that? What's it called though? What's that one? It was one. It starts with a P.
Is this a hormone replacement therapy for menopause?
When women were going through perimenopause,
Oh, yeah.
doctors would prescribe this medication.
Oh, your progesterone.
Progesterone.
Oh, yes, the oral. So that's interesting. So we could talk about traditional,
But it caused an increase in the risk of breast cancer.
There's forms of oral
The synthesized one, yeah.
progesterone,
Yeah.
like synthetic.
Yeah.
Those have been shown to, increase your risk of certain
Right.
cancers.
And
But
so that,
the micronized progesterone, the oral micronized progesterone is very safe.
yes, so that though,
Yeah.
the studies done on that particular drug,
Oh, you're talking
scared
about the
the-
Women's Health Initiative.
yes, it scared the hell out of women
Yeah.
towards anything hormone,
Yeah.
because it was a deeply flawed study. But
It
it
was,
basically,
Doug. It was
yeah,
a deeply flawed
it was
study.
deeply flawed study.
Yeah.
And that's not unusual, by the way. Deeply flawed studies that are sort of thrown out into the limelight before they should be thrown out into the limelight, before they're even maybe peer reviewed. And then they set a whole new trajectory for the medical.
Well, for women,
Yeah.
women experienced there's 2 decades of women that were sort of did not have access that easily to hormone replacement. And Doug, I saw those women. I saw their quality of life. And overnight, many, many women were affected by that study, and they continue to be today
Yeah.
because it's hard to take back that fear.
It is, especially when it comes from the medical community.
Yes.
You
And
know,
and
when the
doctors
medical-
even it scared the bejesus out of doctors and patients, right?
Yeah. So let's talk a little bit about doctors, because,
Your favorite.
well, my favorite, yeah. I've had many experiences with doctors over the last 6 years since my heart surgery, more than I'd like. And this is just my perspective, but I think doctors operate within a very tight framework that's dictated by the College of Physicians and Surgeons, that's funded by the pharmaceutical companies, the studies, and they're afraid to step outside of that. So when a study comes in and it says, oh, don't prescribe, hormone replacement's bad for you, they all just sort of scramble into their corner saying, okay, we got to shy away from this stuff. And there's very few doctors. I've only met one or two that actually think for themselves, like think rather than just do, almost like robotic doing, like, oh yeah, I'll look in the book. When you have this symptom, I'll give you this drug. Who actually think. Now, maybe they won't say certain things because they're scared of repercussions, but they think. And that's rare. I find it rare with doctors. And so they frustrate the hell out of me because I'm a thinker and I will. And, the internet is probably the worst thing for these doctors because people go and do their own studies. And there's really good information and there's really shitty information out there, And, but I'll go to my doctor with knowledge and want to talk about it.
Mm-hmm.
And doctors don't want to talk about it.
That's been your experience? No.
Most doctors.
Okay.
I have one doctor, I mentioned it to you earlier, who I think is one of the best I've ever had because we have conversations.
Oh, nice.
Intelligent conversations. I actually had a call from
He has time though, Doug. This is a private healthcare doctor.
But I had one actually recently, a cardiologist.
Nice.
Who I'd never talked to before, who was calling me just to do a checkup on my stent and that I was on the blood thinners. He was new from England. And we had this amazing, intelligent conversation. Like he cared enough to inform me and answer my questions and tell me stuff that I didn't know and conversation. But it's so rare. And I told him, this is amazing. Like you're one of the best doctors I've ever talked to. Because in the end, I felt like I was informed and I could make an informed decision.
Nice.
Yeah. But I don't have a lot of respect for a lot of doctors. And I find them frustrating as hell, and they're just like the robots,
Well, they're fairly risk averse. They do take this Hippocratic oath, right? I mean, I'm going to, I'm going to speak on defense of the doctors in this case. I'm going to try, Doug, right? I want to hear a little more.
Because you're married to one?
It's not because I'm married. Well, being married to one, I have an appreciation for how smart they are. I know a lot of people don't want to hear this, okay? But getting into medical school is still one of the hardest things. So you're required to be beyond smart, Doug, like top of your class, like top academic, maybe you get in if you build a village in Africa as well on top of being so what we're asking is for people to be of the highest academic standing.
To become a doctor.
So it's not an easy job, everyone. It's not as easy as Googling.
Okay, but I'm going to pause you there for a second.
Yeah.
So I don't give a damn about smart. What I do is, if smart is attached to caring, if smart is attached to thought process, if smart allows you to have an intelligent conversation with another smart person. I'm not book smart. I'm not intelligent. I would never be a doctor because I would never get through all that it takes to get to be a doctor. But I'm a smart person.
Yeah,
I'm intelligent.
You're very intelligent.
Right? I'm just not book smart. anyways, I'm not book smart, but I'm smart. And I want to be able to have a conversation with this other smart person who spent many years in school to become a doctor, who studied the books. It doesn't have to be mutually exclusive that you're smart and you ignore everything else.
No, Doug, listen, I'm just speaking on behalf of, doctors in some case, because I feel they get a bad rap. I have been on the receiving end of pompous doctors, like the pomposity index. I'm not saying that they're not incredibly annoying sometimes and difficult to, sometimes I the human side of them. It's not the first thing you see. Yeah. However, I've worked with many doctors in my life, and I watch how they practice. And by and large, they're very conscientious human beings, very hard workers.
Oh yes,
and
I don't question.
They don't
that.
take risks. They're risk averse.
If I hadn't had some really good doctors, smart like the other doctors who talked to me, if I didn't have that experience, I'd say, okay, well, this is the way it's supposed to be. But because I've had a couple of doctors who really spent time to talk to me, inform me, listen to me, and respond to what I had to say, I realized, well, it can be this, So the contrast makes me realize that 8 out of the 10 doctors that I talk to don't give a crap what I have to say. And they're really, they want to tell me. I had a doctor who I paid, it was a paid service. And at some point, he confronted me and said, look, I'm the doctor. You're the patient. We're not having a discussion. I'm going to tell you what needs to be done. And I said, oh, that's good. Well, you're fired. Okay. I didn't tell him he was fired. I just stopped the service.
Why didn't you tell him he's fired?
Well, in the moment, I was.
Were you shocked? Was it a bit shocking?
I was like, Well, yeah, because I left going, hold on a second. What the F, man? Like, I pay this guy and he just wants to tell me what to do. He doesn't want to hear. Well, what I did say is, well, yes, you are the doctor and you have knowledge. I said, but I also have knowledge. I know my body and I do research and I understand myself and I need to have a conversation about it. So yeah, I didn't confront him in the moment. I just stopped going.
And so you
So paid or not doesn't mean it's a good
well, you know what,
experience.
and it's not regardless if you're paying, us as healthcare professionals, even if we are in private practice, we still have a college to answer to, right? And
Yeah.
we can't be bribed in Canada. You can't do that. You have your
I would never bribe
no,
anybody.
but I'm not saying that. But at least he wasn't doing. I mean, I'm going to go on his defense. I'm sorry.
You go ahead and go.
I'm
No.
sorry for your experience. No, I don't. It sounds horrible. And
No,
I've
it's a
been
learning
there.
experience.
But you know what, Doug? What were you asked? What may I ask the nature of the disagreement?
Well, I don't remember exactly. I mean, probably some of it was around TRT, testosterone
Oh, okay,
replacement therapy.
TRT. Okay.
And
So
you know,
most doctors terrified, like not terrified.
And it's not easy to prescribe testosterone to a man. It's not. There has to be very specific symptoms, including a low T count.
Well, I mean, there's
Anyways.
practice guidelines, and some people are just like a cardiologist would not be at all. Sorry, cardiologist, but they would not even that would not be in their interest.
Although studies, proper studies, and the compilation of many studies done by the Mayo Clinic shows that testosterone replacement therapy improves heart health
Okay.
and prevents cardiac issues. But they'll tell you that no, it's risky, but it's the opposite. And again, it's based on some 2 or 3 flawed studies where doctors believe that it's risky, right?
But it
Anyways,
didn't
my
stop
point being
you.
that my experience with doctors, because I've had a lot of them in the last 6-7 years, for the most part, have not been good. I mean, I've gone to doctors that I walked out going, I'm never coming back to this doctor. This guy's insane. Like my
Try
first.
going to a dinner and sitting next to them, Doug. Want to talk about a party ender?
Oh, you should invite me to a
Welcome
party
my
where there's a bunch
life.
of doctors.
Oh my
I won't be
gosh.
invited back, by the way, but nonetheless, I'd
You
probably
know
have
what?
fun with it.
They're kind of fun when they're residents,
So let's go back to
Yeah.
perimenopause because, again, this is part of the medical system. Perimenopause, it's a woman-specific thing, and I think women probably suffer at the hands of a lot of doctors because their doctors either don't understand or they're stuck in some flawed study or the system tells them this is what they have to do, and women suffer. And because I've seen firsthand with a couple of women I know, watch them suffer through really bad advice and treatment,
in the perimenopause. What
In the
what is
perimenopause.
it that you experience or you saw?
Well, I just saw that it didn't get better, that they just went through hell.
Okay, when you say hell, what are the
Well,
symptoms?
night sweats
Okay,
and,
yes. Vasomotor.
daytime, like hot flashes and like feeling crazy sometimes and depression and body stuff. And, although body is not the most important, body, gaining weight and a lack of energy and agitation. And I mean, it's like, to me, it just seems like the worst place you could be for one day, let alone day after day after day after day,
Decades.
month after month.
Decades, Doug. It can last a decade.
Yeah.
Yeah.
Like one day of that would drive me nuts.
Yeah, it's you know what it's a very tough time, and my personal experience, my own personal experience is the reason why I have Kelly's clinic today.
Yeah.
So that women have access to hormone therapy if they decide, of course, because our system is at the max, right? It's maxed out right now, and there's no priority for menopause, women's health, perimenopause. There's a women's health center in Ottawa. It's like a 2-year wait list, and that's not going to change. So women,
2 years is unacceptable.
yeah, that is. So Doug, what happens in perimenopause is, the fluctuation and those symptoms that you're talking about, that's like estrogen, like plummeting,
Right.
right? And estrogen is so vital, for most of us, for all of us. It's vital for all of us, like
Well,
you say.
it's vital for men
And
too.
it's vital for all of our mental health. Like
Yes.
there's estrogen receptors and testosterone receptors throughout our body. and in
Yes.
our brain.
Yes.
Okay, so critical period, perimenopause.
So let me ask you, I'm just going to
Yeah.
pause here and ask you a question. Is perimenopause now taken more seriously? Because my understanding was it used to be, well, this is just part of your getting older and, deal with it, go through it. Is it taken more seriously that this is a treatable, these are treatable symptoms?
Well, because of social media and people like you, Doug, it is like there's a movement going on. There's a whole generation of women and so there's this menopause. Let's talk and own your menopause, and so the awareness is coming now. My business exists clearly because a lot of the family doctors are not up
So
to
we
date.
need 1,000 more of you in Ottawa alone.
Yeah,
Not
thanks.
that you could be replicated, Kelly. You're very special, but 1,000 more of a 90%
But I'd say
version
it's
of you.
coming, Doug.
It's
I'd
coming,
say
eh?
it's coming. I would say that medical school, like I've actually looked at the medical school, learning module for menopause and perimenopause. Because my son went through it not long ago.
Yeah.
It was much more robust than it had been in my husband's day.
Oh, yeah. I think, when I look back at the medical system, and it was mostly run by men back in the day, and treated women so poorly, not intentionally. I think it was lack of knowledge, ignorance, but, getting, when you have your tubes taken out.
Oh yes.
It-
No,
it wa-
when you get a hysterectomy,
Hysterectomy. So hysterectomies were being handed out like candy.
Oh yeah. There was a saying, Doug, when in doubt, take it out.
Yeah.
When in doubt.
Like
That's like
the way that women were, and I don't think intentionally to hurt them, but out of absolute ignorance
Yeah.
in the medical system was just terrible. And I think perimenopause is still one. Like you're saying, is an awareness coming. Thank God for the internet and thank God for social media. But there still, I think, is a struggle, even for the women,
Yeah.
say, I need to do something about it. And they're scared to do something about it. So the medical system that used to be, and now maybe is being forced to change. And the women who've been filled with really bad information about, treatments for perimenopause, like I'm hoping there's a convergence that the doctors and nurse practitioners and the understanding of what it is come together so that women can get that help that they need.
Well, you know what? I think that starts the conversation, right? Getting the right information out. There's still so much misinformation, Doug. You go on social media and they go,
Yeah, I mean, there's really crappy information. There's really great information.
and so having access, and going to your family doctor. I think if people don't have a family doctor right now, then that's not helping the cause, right?
And that's really hard to find.
And that is exceptionally hard to find.
Like crazy hard to find. It's
No.
disturbingly hard to find a family doctor.
Well, apparently a lot of the apple trees are taking patients and they'll take them on, but but you don't necessarily get to see the same doctor each time.
No, you're in a pool of doctors.
You're in a pool of doctors, yeah.
I mean, personally, from my experience, having multiple doctors, it's really hard to communicate with multiple doctors because you're having to repeat the same thing. I'm having internet problems here, and every time I call Bell, it's
You have to repeat the problem.
it's like another person. I'm
No.
like, can you read the notes?
Yeah.
And I just it's not the same as doctor, but it's like I liken it to that. Going to a clinic is great. It's great that we have clinics.
Yeah.
You can drop in. You can get. But not having the same doctor, someone not knowing your history, not walking the journey with you. Back in the
Makes a
day, in
big
my
difference,
day,
yeah.
we
You
had
had
a
a family
GP
doctor?
we had a
Yeah.
family doctor that had been in the family for 30 years, And so they knew everything about our medical history, good or bad, doesn't,
Well, that's you know what, Doug, and medicine is advanced and people are getting sicker, and so that traditional style of family practice, there would be a great opportunity for nurse practitioners, right?
Yes.
Absolutely.
I'm very pro nurse
I know.
practitioner.
I love this. I love this. Now that you know about us,
Oh, yeah.
So the problem is we cannot bill OHIP right now. Like we don't have the ability to,
So
I have to charge
it's all
people private.
practice,
Well, no, most nurse practitioners get hired by on a salary.
but it's all a paid service.
But it's paid. But they're on salary. So
but
that fee
is that
for
going to
s-
change?
no.
It's not going to change.
No, I think that it's, you know what? I mean, it's been this way for a long time, and nurse practitioners have never taken advantage of it and used it as an opportunity for private practice because
No, sorry. Is it going to change that OHIP will cover it?
no, why would it?
Well, because it's needed.
Well, I mean, obviously not because they would be doing it, right?
Oh no, that makes the assumption that our politicians are smart. Uh,
Well, someone doesn't want it.
well, probably our current prime minister is an idiot. So,
But I don't actually, you know what, Doug? I don't want to ever go back to having to see people in 10 minutes. Like, I don't like that. Like, that's what OHIP gets you. It's not like I'm just, yet again, to defend the doctors. I have to. Like, it's not an easy job. It's no longer easy. Doug, you get barely any money. And like, the only way you can sort of generate a revenue is to see that many people.
oh,
in a
I
day.
know. I know that they get paid a certain amount per visit, and yeah, I
And I
understand.
don't, back even not that long ago, there really wasn't an OHIP billing code for perimenopause and menopause.
Oh, is that right?
Yeah. Yeah. That's probably changed. I'm out of the public health system now, but it wasn't that long ago. There was no billing code for that.
Okay, so Kelly,
Yeah.
I really want this discussion to be able to help women.
Okay.
Women who are struggling with perimenopause, who are afraid of what they've heard about hormone replacement, who can't find a doctor or even nurse practitioner who will even help them through this process. What do you tell them? Like, how do we get the message out?
Well, you know what? First of all, there's a lot of great resources that these women can use, right? That are like, there's apps. There's like the Balance app. It's a free app.
Okay.
I'm not I'm not affiliated in any way, or am I getting any money from this app? There's
You
a
hear
lot.
that Balance app? You should be giving Kelly some money.
No,
She's
no,
promoting
it's not.
it.
It's
I'm
but
kidding.
there's a lot of information. There's there's the Menopause Less Talk. You could go on to the Canadian Menopause Foundation. You can go on to the Society of Gynecology and Obstetrician of Canada, or the North American Menopause Society. Like there are some legitimate resources that women can use to get accurate information. Now, for the access part, Doug, the access part, well, if you can afford it at this time and you don't want to suffer, you don't want, like some women don't suffer at all. They're fine. They don't have any problems. And, but if you can't get to the diet, the exercise, the whatever you're supposed to do to help ourselves, you really can't get there and you need help. There are a lot of private options for women.
Even diet and exercise. I mean, though, one person I knew who suffered from perimenopause, I'm sure she was perimenopausal, dieted and exercised and still went through hell.
No, Doug. Doug,
Went
I
through
had
hell.
mine started in about 45, well, probably earlier. Okay, here are the things we're going to tell women.
What are the symptoms? What is it that happens? So the women out there hopefully watching this show.
We should have started with the definition. Perimenopause is when there's just starting to be a change in the regular fertility patterns, right?
Right, but I mean, what is the exterior symptoms? Like, how does a woman recognize that she's in perimenopause, or potentially in perimenopause?
Well, just what you were saying before. If you're starting to get night sweats,
so I said it, but I want you to say
night
it
sweats. Like if you wake up and you're sweating.
Yes.
Like, does that
That's
not happen to
normal.
men?
I'm sweating all the time.
Okay,
I'm just hot in bed.
Oh, and sometimes it's like Doug. It's like change the sheets, change the bed. It's a soaker.
Oh, it's soaker.
Your ankles are soaking.
The clothes are soaking.
Oh no, it's soaking, and then you have a chill and you're freezing, and then your sleep's interrupted, and then
so that's a really obvious sign of.
That's very obvious.
Could it be
migraine?
Not perimenopausal. Like, can those that symptom come from something else? Okay.
Yes.
So these are potential symptoms of perimenopause.
But if you have those symptoms, you should go and tell a healthcare provider, right?
Okay. So what are other symptoms?
Oh, well, other symptoms. Well, there's so many, but people don't know about. But like increasing in your menstrual bleeding, like we start to see really, really heavy bleeding, which then goes on, Doug, to cause anemia, iron deficiency anemia.
Right.
Severe fatigue.
Right. Because this bleeding can go on longer than a few days too, right?
No, it goes on for, like I told you, decades. And then and you're losing copious amounts of blood because there's.
So this person was definitely perimenopausal. Like the symptoms, I think every symptom you would describe, she was experiencing.
And, so thermo dysregulation. So sometimes in the day you're feeling hot,
Right.
Headaches,
Yes.
like significant headaches and return of migraine headaches. For me, I didn't have, like I had migraines in my adolescence. I didn't have them for what felt like forever. And then all of a sudden, migraines, and that's from the fluctuating estrogen, very
Right.
sensitive to that. And Doug, like headaches where you can't work. And then
Yeah.
and I think that,
I've never had a migraine.
no,
I've watched this
it's not just
particular
a
person
headache.
with
Yeah.
migraines, and I think, how do you even function? I've been in a meeting with someone, a guy who had got migraines, and he had to leave. He's like,
No.
I can't function anymore. Like I got to go.
Well, depending on the severity, a lot of times they feel like you're having a
sensitivity to light and
stroke,
stuff.
like you can't see, and
Yeah.
half my face would go numb. Like every time I had a migraine, I thought I was having a stroke. And I have knowledge, and I know it doesn't work like that, but it's petrifying. It's
Okay. What
petrifying.
about
The other symptoms,
psychology, like the
so
psychological?
well, you can get mood swings, like definitely lower mood, a lot of times agitation.
Right.
So, irritable. And then a lot of women who are on serotonin reuptake inhibitor or medication for their mood and start to notice that these meds are no longer working. They don't work. And the reason why is because we need the estrogen. We need the estrogen for the SSRIs to work.
Right.
Right? As our estrogen starts to decline and be depleted, so do all our other neurotransmitters. I think I
Right.
might have said that a little already, right? But
Yeah.
so, Doug, it's very critical and potential time for all mental health conditions too.
Okay. So what are the main hormones? Estrogen is primary for a woman.
Yeah,
There
estrogen
is
is our
but
fertilizer.
testosterone is actually is there's more testosterone. A woman has more testosterone than estrogen, my understanding, but it converts to estrogen. A woman has way less testosterone than a man,
Yeah,
but has more testosterone than estrogen that converts to estrogen. So
yeah. Well, a woman's ovaries produce like 3 times the amount of testosterone as estrogen, and you're
Yes.
right, and a lot of it.
and so there's testosterone,
But
estrogen,
we need our testosterone,
and there's
progesterone.
progesterone.
So estrogen, let's say estrogens are like our fertilizer. It's like we have estrogen receptors everywhere.
Yeah.
So perimenopause, a lot of women start complaining of joint pain. And then
Right.
they think they have like Lyme disease or like
Or
all these
arthritis
arthritises do start to present themselves. So most women,
because estrogen also affects bone density.
yeah, no, well, it
And heart
affects
health.
estrogen affects your bones,
Yeah.
your heart, your skin, your brain, like everything. Everything.
Yeah.
So the chronic pain and chronic fatigue, those are other symptoms
Okay.
that we start to see. GI symptoms, so like acid reflux or constipation, because your GI tract, that's your major organ, it starts to slow down as estrogen goes down. Like just think of estrogen as a fertilizer. Progesterone is like the lawnmower, which like keeps the grass mowed of
Yeah.
the lining of your uterus.
Right.
So progesterone prevents overgrowth of estrogen. So that precious balance starts to get out of whack in perimenopause, and there we start to see some heavy bleeding.
And is the testosterone primarily to be converted into estrogen? Is that why testosterone exists in a woman? For man, it's a whole different thing. But
Why does testosterone? I don't know. But I would say that it's critical for our mental health, our cognition, and our bones and our muscles,
right.
our libido.
But I was watching a interview with Peter Attila.
Okay,
Dr.
yeah.
Peter Attila. I know you like him.
Well, I like him because he's talking about menopause and perimenopause.
Oh yeah, he's a warrior for
saying
women.
that there's been
Not intentionally, I think, but
yeah.
he's the one who brought up the fact that there's more testosterone in a woman than estrogen, and I think he was suggesting that it aromatizes,
yeah.
so it converts to
Yeah.
estrogen, and so it's also a very important hormone for women to pay attention to.
Absolutely.
Yes.
Absolutely. And, although it's not FDA approved or like that's really not on the sort of clinical guidelines at the moment. That's more off labeling. We're using it for a variety of things, typically menopause more than perimenopause,
Okay.
because really menopause, that's when you're no longer producing any hormones.
Right. So if you start the hormone replacement therapy during perimenopause,
Yes.
you would just continue on
Yes.
maybe to different levels, but you would find some sort of balance into menopause and then continue on, right?
Yeah. Interestingly enough, Doug, we're now learning that the earlier we start hormones,
Yeah.
you know, the more preventative it is of protecting you from developing these secondary diseases
Right.
like heart disease,
Yes.
diabetes,
Yes.
obesity, like osteoporosis, dementia. So like I've been around a long time, Doug, right? I was a bedside nurse. Like if people should listen to me, because I know, like in this case, what you don't want to have when you're older, and like we don't want to be, like I'm petrified of being frail, old, and disabled.
Just
And
that osteoporosis, like this.
yeah, the broken bones.
Oh my gosh. I mean,
And dementia.
it's so scary. It scares the hell out of me to have such frail bones, and it's so preventable,
I mean, it is. It can be preventable
Yeah.
if you are. There are women who can't tolerate hormones, or they've had certain cancers that make them higher at risk. So not everyone can have the
Right.
hormones, or no, it's not safe for everyone to take. Just FYI.
Right.
But a lot of times,
But without the cancer present, so
Yeah.
my understanding is without the cancer present, it's actually more preventative
yes,
than it is
yes,
dangerous. And that's another misconception.
Yeah.
Because I'll tell you that when I wanted to go on testosterone replacement therapy, my doctor was saying, well, it's going to increase your risk of heart disease and cancer.
yeah,
The studies I've read, which are many, and I read for like the National Institute of Health, like I go deep dive into this stuff, is exactly the opposite.
Mhm.
If you don't already have cancer, it's actually more preventative for cancer. It's more preventative for heart disease. And like they're misinformed. They're misinformed. Like they're telling
Well,
wrong
I think
information.
that there's just Doug, like they're, yet again, I'm going to come to their
You
defense.
come to the rescue?
I gotta
Sure.
come to the defense because they are risk averse, right? So randomized controlled trial, like evidence-based medicine is, you really want
Okay,
your
risk adverse.
person.
So if I go to my GP, which
Yeah.
I did, an old GP, and I
Okay.
haven't been for a while, and I see, he was very against me taking testosterone
Okay.
and all that. And I said, look, I have a study from the Mayo Clinic, not my study from the Mayo Clinic that was a compilation and an assessment analysis of 23 studies on hormone replacement therapy. Do you want to see it? He goes, no.
No.
I said, why not? He says, I just don't want to see it. But this is not me telling you. This is a renowned clinic in the United States that did a study on the
It's
studies
not that, listen, like it's,
just to be informed.
Yeah.
Even if it didn't change anything you did, just to be informed.
he did, he didn't. Well, Doug, men, and I mean, there's some egos here. Like you don't get into medical school because like you don't know how to do research and read research and interpret research. All right. So I don't know. Obviously the way it was presented or how it was presented. I'm not defending any of that. I'm sorry that it was so difficult for you to access this, but you didn't give up. So you eventually got testosterone.
I'm rare though, Kelly. And,
Yeah.
and I think, I think we're speaking to women mostly
Yeah.
right now is I don't know how many women are going to fight for their health. I don't know how many women are going to stand up and speak back to a doctor or say, no, this is what I want. I did a great interview with, I don't know if you watched any of the clips
Yes, I
from
watched them all, yeah.
Melanie Albert. She fought for her life.
Yeah.
Like she spoke out against the medical system. And that was in the time of COVID. They didn't want to do surgery. They wanted to do treatment, although surgery should have come first. And she insisted that she was going to get surgery first. And they did surgery first. But I think she's also rare, like how many women are fighting for their health and saying, no, I want the proper treatment. I don't want to just.
I don't know if that's happening as often. I just think the information, Doug, is still not like accurate information has not, that we're still at that phase of giving it to women. So they even know, right? Like we're still in the fear part, but you're right. If like many women do not stand up and they do not fight. And especially if their hormones are low and they're feeling depressed, because as I know very well, depression usually means you can't do anything for yourself.
That's right.
You can barely get out of bed. And
But I think it's also
you just don't deserve better treatment.
It goes back to our view on doctors from history was they were the beginning and the end.
Yeah.
And the doctors couldn't get it wrong. And so the doctor could tell you anything and you would do anything. Whatever the doctor told you to do, you would do because they're doctors.
Yeah.
I think that's starting to change. Like,
You
yeah,
think,
okay, you're
you
doctors.
think. People, like, that's changed.
Yeah, and you said yes, they have to study hard. They had to go through what, 7 years or whatever it takes to become a medical doctor, and they're intelligent and they're book smart, but they're not the end all and be all. They're still human beings and they're still worthy of discussion. And I really would encourage women to take charge of their health. Do not just listen to the doctor. Yes, the doctor might have good information, but yes, you can get other good information, and don't be passive about it. Like, it's your whole life.
But you know what? But be respectful too when you're coming in to share articles or information with your healthcare provider. Be respectful that they also have some knowledge too.
Yes.
Okay. So if
But respect has to go both ways.
If the study you print off, and yes, respect does have to be. But Doug, I've been on the receiving end of people coming in and in their infrared sauna stuff for their like serious medical condition when I first started practicing.
Yeah.
Like they're aggressive and like sometimes people even come to me now and they don't like anything about Western medicine, but they're forced to come with me because their naturopath can't prescribe what they need from me. And they're actually rude.
Well, that's just not okay. But
like
that's,
hostile. And
Yeah,
it's that's not a very nice feeling.
no.
No.
But don't be rude and hostile.
Like
But
I'm like, we're all, anyway, I don't, you know what? I don't go to doctors that often. You know what? I don't have to.
all you got to do is look across the dining room. You got to do is look across the dining room table and say, honey.
So my experience again is, this is my own personal experience and my observations of being around a lot of physicians a lot of my life. A lot of times very privileged. Sorry, I know not everybody but very privileged. Someone's been telling them they're wonderful, they love them, they're awesome, they're smart. We want to hear my favorite doctor joke?
Sure.
I don't know. How do you know when you're in a room full of physicians? I know. Pick me. You know those kids?
Yeah.
You know those kids?
Yeah.
That's doctors, man.
Oh, wow.
Right? Like.
Just pull your mic closer.
Sorry. A lot. So, many have not suffered. I mean, I know that some have, but some of the harder side, human side of life, and it makes them a little bit too removed.
Yeah, hardship. Can you move your chair just a bit closer? You kind of jumped away from the mic there. Hardship is one of the greatest teachers in our life.
Yeah.
And yes, if you've come from a privileged family, I mean, it takes a lot to get through medical school financially too. Like, and I'm not saying all doctors are privileged. No. I'm sure doctors have scraped themselves out of a hole and found their ways to be doctors. But hardship brings out the best. It can bring out the worst in people, but it can bring out the best in people as well. And I know just a bit of your story, and so you've struggled in different areas, and it's brought out from you, praise God, is this amazing, loving, beautiful heart that really cares for people and really wants to help people. And I think you've gotten to a place where, with your clinic, anyways, you're only really interested in the people who want your help.
Yeah,
if you really want my help, I'm here for you. If you don't want my help, you can find a lot of people who won't help you.
And what I provide, you're not going to get from a doctor. Like forever, I wanted to be a doctor. I wanted to be a doctor. I wanted to be, but like now I'm learning, I want to be me, right? I want to be me because I did have all my own experiences, and I have had my own experiences with the healthcare system. Certainly with the darker side of me, mental health, addiction, like whatever. Like I have real human problems.
Yeah.
So I treat other humans with these problems in a way that I would have liked to have been treated.
Beautiful.
And I had, it was hard for me. You're absolutely right. It was hard for me. Like I didn't go and get help that I needed because I was intimidated and I was afraid of doctors. And
okay, let's talk about that a bit. So we had this is going back a few months now, or a couple of months. We had a conversation at a coffee shop about the patriarchy, and we had a good disagreement around the patriarchy and women are oppressed and all that stuff.
Yeah, you didn't like that. You didn't like when I said women are oppressed.
Yeah, I challenged you on it, and and I still would challenge you on it. But I think now, like women, I think, have to stop saying they're oppressed by the medical system and stand up to the medical system. Like you said, don't be rude, don't
Yeah.
be mean, but be assertive and stand up for your health. Like there's nothing stopping a woman as there's nothing stopping a man. So I had a disagreement with a doctor. I said, okay, I'm not coming to see you again. My first cardiologist was insane. Like I think he was clinically insane,
Oh,
this
really?
guy. Oh yeah, this guy was a
Oh,
nutcase.
exciting.
I left that office. It was the first time talking about my heart condition, right? I thought, I'm never coming
How
back to
long
this
ago
guy.
was that?
7 years ago.
Oh, really?
2016.
Okay.
Is that 7
A
years?
crazy
6 years ago.
cardiologist. Wow.
7 years.
World just got a little more exciting.
Crazy. Like this guy was foaming at the mouth, crazy. And I thought, I can't believe this guy's a doctor and he's giving it medical advice. Like this guy is, but I have been in for a long time taking charge of my own health.
Yeah,
Like,
you have.
this is my life. This is my body. I've been given to, but God's given me this one body that I'm going to die with, but I'm going to manage it. And I'm not letting anybody tell me what to do. I'm going to listen to the smart people, but hopefully listen to me too. But how do we get women to be assertive? Like stand up for your health. Like
Yeah.
don't just listen to doctors. Don't just listen to,
And I think a lot of women just don't even know what to expect. Like they don't even know because haven't aged. So they have no idea now what their lives are going to look like when they've spent 10 years without hormones. They don't know what that looks like. And that to me is really scary. Like that's
Right.
really scary. And that's a form of oppression. Like Doug, I think, there was a brown man and a white man, a yellow man, a green man, an orange man, and every single color man that all got together in 2000 and said, whoa, these women are going to take over the world unless we take that hormone away from them. And that's
I don't know about
that's
your
what I
conspiracy
think.
theory.
I think that was just like, because the women I have who are in their 80s, they're my heroes, they're living independently, they're all still on hormone replacement therapy.
yeah.
Yeah. And they ski and they travel and they think.
I think it's
and they don't
ignorance more than it
drink.
is power.
Hey?
I think it's ignorance more than it is power. I think that whether it be men or women, but mostly men probably in the medical industry, it's been about ignorance. I'm not talking about pharmaceutical companies. Pharmaceutical companies don't want to. I mean, they can maybe make money on hormones, but
No.
they can't patent them.
Supplement companies were the ones that made all the money when the hormone scare came.
Yeah,
in.
so we
But,
talked about
yeah.
this earlier.
Supplement
If there's money to be
companies-
made, and if it's a public company,
if there's
their
money to be
their
made,
focus is on the bottom line, so they can report to the shareholders that they're making money, and they'll do whatever they can to get there. I think it's very short-sighted because I think that actually you can care about people and come up with stuff that really works
Yes.
and make money
Yeah.
doing it. But most companies don't think that way. It's like,
No.
we're going to cut corners. We're going
I know,
to market the crap out of garbage. We're going to, we're going to get our stuff made in countries that don't care about
No.
what is the toxicity in this stuff, and because it'll make us more money, right? And that could be supplement companies, it could be
Anyway.
pharmaceutical companies, it could be big pharma, whatever.
Well, I can guarantee you that I have so far made no profit.
Well, that's not
you
good
know
either,
what?
Kelly.
I know it's not good, but you know what? I'm going to get there. But I agree with you, right? Like it's hard if someone's profiting, like if someone's profiting out of your health. Like you have to be careful, right?
We live in a
Yeah.
system that is designed to make money, right?
Yeah.
So you look at big pharma and COVID and the vaccine, which was bullshit, and how much, and people were so scared because they were listening to doctors and big pharma and government.
Are
and
we
then
going there?
Where are
again?
Huh?
Are we going to go there?
just for a second,
Okay.
the three worst places to get true information. One is our government, like they're the most honest.
Okay. Come.
Next is big pharma, if they're poised to make hundreds of billions of dollars on it. And the next is the doctors who are sort of told that this is what we got to do. And they're not going to tell you not to get a vaccine because if you die,
I
now
don't
they're
really
liable.
think that, you know what? Can we go on to a different subject?
Sure.
Sorry, I can't argue with that well enough. Someone else needs to challenge you here, right? Like
Well, you don't have to argue with me. I'm
No, I
just
do. I
saying-
need to challenge you, Doug, but I just,
I'm
my
just,
head is not
so my
there.
point is going back to women and empowering
Yeah.
women is ask questions before you jump in. Like really challenge it. Say, is this, even if you're not typically one to, because there's different kinds of people. I'm like, I'll jump off a cliff and then check to see if I have a parachute after,
Yeah, me too.
I get myself in
Me
trouble
too.
that way. But, there's a lot of people who are very cautious, but it doesn't hurt to ask the question, is this true? It's a very simple question to ask. Is what someone just told me true? And you can go on the internet or you can talk to other people, get a second opinion, get a third opinion. Is it true? And if everything points to, yes, it's possibly true, it's more than likely true, okay. But if you start getting this opposing information that, no, it's not true. And I'm not talking about blogs and, people's stupid opinions, but, some really educated sources, and you start getting contrary information, well, then it starts to, it's sort of, okay, take it to the next level of questioning,
Well, Doug, I think if you walked out on the street and asked 10 women what they thought about hormones,
Yes.
and birth control is hormones, right? Like,
yes,
birth control is also hormones. You do that, and then we should do that. That'd be interesting.
well, so a woman I'm close with these days, that exactly thing. Like, I said, she talked to Kelly and the hormones, and because she's going through perimenopause, and it's like, I heard about hormones, and I'm like, no, you heard wrong, and that's misinformation. Luckily, she's open-minded enough to consider, she's not going to set up an appointment with you, but yes, I would think that most women are terrified of them because they've been told be terrified of them.
And I think most women should be terrified of heart disease, sarcopenia. Sarcopenia,
What's that,
that's
sarcopenia?
the scariest, where you lose your muscle mass. Like, you just get, because you need hormones.
Yes.
You need estrogen, testosterone. You need that to build muscle.
And I like that
maintain
you're pointing at your legs, by the way,
Yeah.
because the first thing to go is leg muscle.
Yes.
And then you lose balance
Oh, no.
and stability. Like my mom is 89,
Okay.
and she trains 3 times a week with my trainer.
Oh, wow.
And they only focus on legs
Yeah.
because, and she's not on hormone
No,
replacement.
no.
At 89, I'm not going to
No,
put her on
no,
hormone
no,
replacement.
no,
It's too late.
But she's doing
But,
what
she's training her legs. And she takes creatine, which I think is a good supplement. It helps build muscle strength. And she's taking just things that I believe are actually legit. But point being that, the legs, you were saying muscles going. You were grabbing your legs.
Muscle.
But the legs are the first thing to go.
Mm-hmm.
And there goes your stability. There goes your sense of safety.
Yeah.
Like, you're going to fall, and then you have osteoporosis.
Safety.
And you have osteoporosis, and now you fall and you break a bone. And now it all starts to fall apart, right?
There's nothing more petrifying than being weak and frail.
Oh, yeah.
I
plan on going out kicking and screaming. Like, my goal is to...
Same here, Doug.
I don't care if I
Same
live
here.
till 80 or 90 or 100. I want it to be top-notch, like, standing solid on these amazing legs of mine and, fighting the good fight. And yeah, if I just blow up one day, that's fine, but I'm not gonna fizzle away to nothing.
No, that's the idea. And
Back in
that's
my-
sort of what's been, that's sort of what women are expected to do.
Yeah.
Just
Back in my old
fizzle
neighborhood,
away.
there was a guy, I thought it was a woman actually, but the guy was so decrepit,
Really?
would walk around the block every day. And I thought, if I ever end up like that, just run, because I was always afraid to back up and run him over.
Yeah.
Just run me over. Do me a favor and just take me out. Like,
Well, Doug, we also have to learn how to age gracefully a bit too, right?
yeah, but the aging and falling apart are two different
Yes,
things.
no, I
don't
agree.
think we have to fall apart.
No.
So I am a strong advocate for men and women,
Yeah.
and that's why I have this channel,
Yeah.
is to fight for our health.
Yeah.
To not just let it fall apart, to fight for our health. I'm a good age. I'm not going to tell you guys what age I am, but I'm a good age, and
You're a good fighter.
and I'm a good fighter, and I will advocate for myself, and I want women to advocate for themselves. Screw what might be considered as the patriarchal oppression. I don't think that has to happen. I just say fight for yourself. Ask questions. Is this true? Is it right? If it's not, then do something about it. Stand up for yourself.
Yeah, and you can go on to, many of these resources I shared. We should have it somewhere on your thing that we could share them,
Yes,
a link or something
sure.
like that.
Yeah.
Because you can print off like a little printout to bring to your doctor to help you have these conversations. I know it seems silly, but I've looked at it. It's pretty cool.
Yeah.
It's your assessment of your symptoms. So it would save them time, so you wouldn't have to take more than 10 minutes. and you can
Yeah.
slip it there.
And
But
I appreciate what you were saying about doctors, and I'm glad that you're advocating for doctors because I could easily slam them all day, and
well,
and I think that they need to have an
well, Doug,
alternate
they're kind of
voice.
fun to hang out with because, like, you kind of like. Well, mine is really fun because, like, way before Google was invented,
Yeah.
I would just like plug my question in, and out would come the answer, like an encyclopedia.
Yeah, I get that. My brother was like that for the Bible. He
Oh
was
yeah,
he was a Bible scholar, right? And
yeah.
so I like, hey, what about
No,
this in the Bible? And he's like, Psh,
no, like
out
it's
out comes the
it's
information. Best
great.
Google ever.
Yeah, yeah. You know what? They're great to have in
I'm
your
not saying they're
team.
all bad, by the way,
No, I
Kelly.
know. I know you're not.
I'm just saying that I've had terrible experiences with them, and there is some arrogance there, and the
Oh,
society has sort of seen them as the end all and be all, and whatever they say is true. And I'm just saying, I'm just challenging you to say that there's a good chunk of them that are boneheads, and there's a good chunk of them that aren't, and to ask the question, and you'll figure out who the bonehead is and who the good one is, because they'll answer the question for you.
yeah. They'll answer and honestly, usually quite honest to a fault. You
Yes.
know, um, but
So Kelly's
so
clinic.
you know what, their defects, like you know what, are sort of the way that I exist because if you want something
You
different than
exist,
that,
Kelly.
yeah, I
Yes,
exist.
because you are
Yeah.
the defectless version of a doctor.
I'm a defectless version. I am okay. I'm a great addition as well. Like you don't need to, right? Like our healthcare system now, like you don't, it's just doesn't have what it needs for everybody, right? So
Yes, by the way, I think doctors are, and I've said this in other podcasts, I think doctors are great for acute situations.
yes,
Yeah, break a bone, they're going to fix
like
it. I need
geez,
heart surgery, they're going to open
like
up
Doug,
my
I got
chest.
my arm. Like I would have
Yeah.
never had use of my arm ever.
So for
ever
acute
again. Like,
situations, they're absolutely necessary. But for life, for health span, they suck.
well, yeah, health span maybe
Yeah.
not so much. But
Well,
I asked my husband right now that it's out that he's a doctor, right?
you?
About all this stuff, and he's like, well, well, Kelly, like, we tell people, don't smoke, like, don't drink, like, drink very
Yes.
little, and exercise every day, and
Yes.
follow the food plan. You know what, like,
Yeah.
and then when I listen to him, like, it's a lot of people that probably escalate to the point of like needing often like um high-end medical services have not followed, like have not abided by like don't smoke.
Okay, so when I went in for heart surgery,
Yeah.
I was fit as hell. I
Yeah.
trained 6 days a week. I ate relatively well. I eat better now,
Yeah.
but I ate relatively well. I did all the things that a person's supposed to do, but I still needed heart surgery.
Yes. Yes.
So
But Doug, were you in the minority in that one? I know that it doesn't.
well, when I went into the hospital and sitting in the heart institute, and I would say, yeah, I was a minority. I was like, they couldn't believe that I was there. Like, what are you doing here? Like, well, apparently I have the same problem as
Yeah.
that big fat guy over there.
But so, of course, there's some modifiable risk factors that
Yes.
that humans have. Many times, Doug, people just don't want to do it. They don't want to change.
There was a
their
guy who
diet.
had a
They don't
massive
wanna
heart attack. I
exercise.
knew he was in business,
Mhm.
and he came back to work 6 months later, and I said, "Oh, you're drinking green juice." Like I was like, "Have you changed?" He was a smoker. No, I still smoke. I eat my burgers. I'm like, yeah, that doesn't sound like a good plan. Like, but you're right. People want everything that they had and still be okay.
Yeah. Right.
Yeah,
For instance, I'll tell one story here.
sure.
I had a patient, like whatever. I'm changing the entire situation of this, but this patient, kept coming in and telling me that every time they ate bacon and eggs, they'd have diarrhea.
Okay.
We got like, and I said to the person, well,
Stop.
don't eat bacon and eggs.
Yeah.
Doesn't, right?
Yeah. Like,
But that's no. They want to
doctor,
eat.
when I slam
Yeah.
my head against the wall, my head
Head
hurts.
yeah.
So stop
But so
slamming
I
your head
want to
against the
be
wall.
worked up for every single food allergy and sensitivity and autoimmune condition at, under the cost of the public health system. Like, so Doug, there's a lot of that going on, right? Like,
Oh my gosh.
I have a sore back. I'm going to come in for a sore back, but I'm never, ever, ever going to do any exercise or any
Stretching or any
nothing.
yoga or whatever. People come to me. I'm fit. I'm healthy
You're
for my
pretty
age.
fit. You're the head of the fit chain.
I'm on the top of I believe I am.
Yeah, you're like in the extreme.
Yes. And so people come to me and say, "Oh, what do you do?"
Yeah.
And they
What
want
do
some.
you do?
Well, I'm not going to tell everything I do, but I will in another
I
podcast. But maybe I'll give it out in little bits. But they'll say, "What should I do?" And I'll say, "Look, I would never tell you to change everything,
yeah.
because that's just not realistic. You could do that for a week and then you're going to give up." I said, "Change one thing," and I would tell them the one thing to change: give up chips or sugar or something that's really not good for you.
Yeah.
Oh, I can't do that. I'm like, well, so you really don't want my advice. What you want is me to tell you that everything you're doing is okay and you could take a pill and you're going to be
So
healthy.
you'd hate being a doctor.
Oh yeah, I would.
You would
No, I would be an honest doctor. Only people who would come to me are people who really want help.
You'd be tough.
Oh
You'd
yeah,
be tough,
I'd have a
right?
reputation that, like, if you want to get help, this guy's going to help you.
Yeah.
If you don't want it,
if you can't
don't
do it.
waste his time because he's
Okay.
just going to kick you out anyways. I treat myself that way.
Yeah.
If I'm not serious about it, I have no one to blame but myself. And I treat, when I used to sponsor addicts, recovering
Mm-hmm.
addicts, because I'm a recovered addict. If they didn't want to do the 12 steps,
Yeah.
I'm like, I don't have time for you. My time is limited. It's very valuable. And I will give it to you if you want to do the work. And the same for health, and
Doug, can I interrupt here?
yeah.
Sorry, because something really important just came.
Oh,
to me.
no, good.
Because you were, about women advocating. I'm sorry, but
No, good,
women
go on.
advocating
This is
for
really important
themselves
to me, yes.
because, a lot of times perimenopause, like the women who are really suffering from menopause, perimenopause, like really, like they're not sleeping, and then the night sweats and the mood changes and the severe fatigue and the depression.
Yes.
Often, if you have depression,
Yes.
you don't have the ability to advocate for yourself,
I agree.
right?
Depression is an awful,
like-
awful thing.
It's like you don't like it's really hard to go in and talk to a very intellectual, sort of cold human
It's hard to
being.
get out of bed, let alone
and then face
challenge people for
face
your life.
challenge.
Yes,
So,
I agree. Yeah.
so when you advocate, like have you ever advocated when you didn't feel well about yourself?
Yes.
And was that a little harder?
No. But no. Like when I had my heart surgery, I got C. diff in the hospital, which was way worse than the heart surgery. By the way,
Yes.
way worse.
Okay.
And I could not, for the life of me, get any doctor to prescribe anything that was
Vancomycin
going to heal
oral,
me.
They couldn't.
So I just took charge, and I was like in a terrible state.
Oh,
They had sent me home,
I'm sorry.
and I thought I was dying.
Yeah.
Like I thought I was going to die.
No, that can kill you. It
Yes.
can kill you.
Well, it was getting pretty close, I think. And I was like in the worst state possible. I couldn't sleep, I couldn't eat, and I advocated for myself. But that's just me. I'm like, I'm an
okay,
enigma,
yeah.
like
You don't like being sick.
I'm a fighter.
I don't like being sick either, though. Like, I don't like being sick.
I didn't want to die. I was like,
No, scary.
yeah.
It's scary.
So I took charge. I found the right, and I'm not really big on antibiotics, but I researched and I found the right antibiotic. I could only get it out of Toronto. It was expensive as hell. And I ordered it. I had my doctor order it or get me a prescription so I could get it. And I paid for it. But no, I'm not one to just lay down and die.
No.
But I'm not common. Like I'm pretty rare.
Yeah.
Yeah.
So
For the better or for worse. But
yeah. Okay. So
So depression. Depression is an absolute, and I've seen it, and it's an absolute terrible thing to observe, let alone be in it, I imagine. I've only felt low, but I've never been really depressed. I mean, I went through a bout of depression. It was circumstantial depression, and, I went on antidepressants. So would that be the first thing you would say to someone who's struggling with, whether it's perimenopause or not, is let's get you on antidepressants so you can start making good decisions
well,
for yourself?
depends, right, Doug? Like a lot of times, like true clinical depression,
Yeah.
right? Yeah, I mean, we're now saying some women, if it's associated with hormone fluctuations, the hormone therapy could help that. But yes, the idea of the SSRI is to just like you're deficient in
It's just to get you back up a
you're
little
just
bit.
so deficient, and no
And-
matter how much exercising or praying, or when it's truly a chemical imbalance,
Yeah.
like you don't need that's a scary place to be. And the meds just get you to a place where you can get out of bed,
Yes.
brush your teeth,
have a shower.
Maybe, right? Maybe at first, like maybe. And
Well, it takes time.
Get to the, get outside and get to the exercise and do everything and to your therapist.
And
to help
advocate for yourself.
And advocate.
Because you're right. If you're truly depressed,
Oh.
and depression is not the same as sadness or feeling low. Depression, again, I've only observed it once in a previous relationship, is so dark and so heavy and so, it's like carrying 1,000 pounds behind you that advocating for yourself would almost be impossible unless you're like super woman, you know?
Yeah. And
so,
you don't like,
so
you don't
because,
matter. You're coming like, this is what you feel like when you're depressed. I don't matter.
Yes.
I don't
so
matter.
Perimenopause can cause depression.
Can exacerbate, yes.
Or can make it worse if you already have depression.
Yes.
And so
it's coincided with things like not sleeping, right? And hormone fluctuation. Like, so some people, some women, you get them, like, we don't need to give everyone hormones, right? Like some people who...
No. And we don't need to give everybody SSRIs either.
No.
Right?
But in those cases, like when it is like there's more bad days than good and it's going on longer than 2 weeks, Doug, it's the time to go back and talk to your doctor or talk to somebody. Okay. So persistent symptoms for longer than 2 weeks.
Right. Oh, I've seen it go on for months.
You saw it go on for months.
Yeah. Okay, so we're going to have to wrap up.
Oh.
We could talk all day. We're going to do like many more of these.
Thank you.
But this was a hugely important topic. Menopause, perimenopause, depression, all these things are so important. And, where to get help and all this and fighting for your health, like if you have that ability in you to fight for your health and not just accept the first thing that's told to you, ask the question, is it true? Is it right?
Menopause in You is a website, menopauseinyou.ca. That's the Canadian website.
Okay. Any other ones?
The North American Menopause Society.
Okay.
There's Newson Health in the UK. That's a resource I use often. They're fairly progressive in the UK on this.
Right.
Women's health. They're years ahead of us.
Okay, well, those are three really good resources.
Dr. Newson, she's my hero.
Okay, there's three good resources that people can reach out to, women can reach out to.
Mental health and addiction.
Any final words you want to say before we close off to women? Like, how's your? So let me ask you before you give a final word. Your clinic, you're pretty booked up. I know that you only have limited sessions. Do you want more women to come to you?
I want any woman who needs my help to come to me. Yeah, everybody's.
I'm gonna just clarify that. Any woman who needs your help and is willing to accept your help.
Yes, and
if you need help but you're not willing to accept it.
No, I don't want. I don't want that.
Don't waste Kelly's time. No. She's too valuable.
Well, my heart, because every person
you are
gets
valuable,
my heart.
Kelly.
Thank you.
We talked about gifts from God. Earlier.
Yeah.
And that's one of your gifts, that you have a real heart to help people, help women. And so if you're a woman out there, you need help and you're willing to receive it, Kelly's a great person.
And I was hurting. I've hurt before.
You've hurt.
I've hurt a lot.
So you can feel it.
I know. I can feel people's hurt, yeah.
So any final words to the women out there?
You have choices. You have options. Although it doesn't feel like it, if you're not feeling well, you can feel better. I promise you. This doesn't have to be the rest of your life. And what else do I want to say? I'm here because I genuinely care.
Yes, I can confirm that for sure. Okay, Kelly, you care. Amazing, Kelly. We could do. I think we could do 100.
But Doug, thank you for helping me. And
we could do 100 more of these. Like I don't think we've barely scratched the surface, but. Thanks for today, and I look forward to doing a bunch more of these with you.
Right on.
All right.
Thank you.
Thank you for watching The Epicist, and subscribe and thumbs up and all the things that get us more views, because our goal is to reach people, and I think we are reaching people. I get some really amazing comments. So thanks again, Kelly. Thank you for watching.
Oh, thank you, Doug.